the cuts and how you make cuts and what people are impacted by those cuts is personal to me. I am the majority leader of the state Senate today, but I grew up as a poor kid in Las Vegas all my life. I was raised by a single parent. My mom was 16 when she had me. She was a drug addict for most of my life growing up. I am the oldest of 4 kids and had to kind of take the head of my household and take responsibility at a very young age. My grandmother, who was kind of the anchor of my life, had a severe stroke and was paralyzed 9 weeks after I was born and lived in a nursing home for 27 years until she passed away in 2000. My father, who I didn't know or didn't really grow up with, was shot and killed when I was 19 years of age. Now, I share those things with you because as a legislator, all of that informed my upbringing, informed how I set public policy today. As the majority leader of the state Senate over the last 3 years, we had the largest budget deficit as a percentage of our overall budget of any other state in the country. We lost 30% of our revenue in 2 years. Now, when you understand the state budget, half of it funds K-12 education, public colleges and universities. 30% funds health and human services, including Medicaid, aging services, mental health care, S-CHIPs. 10% funds public safety, and 10% funds general government. When your Republican governor presents their budget and they want to reduce spending by 30%, it's 30% in those areas. So that's when I understood how important it was to have my life's experience inform the decisions we make about where we cut and how we cut. And so that is why we stood our ground and we drew a line in the sand and we said we would not cut education. We would not cut services to seniors. We would not cut draconian places under Medicaid. And with the support of the Supreme Court, they stepped in, our Nevada Supreme Court, and ruled our governor's budget unconstitutional with just 10 days left before we adjourned. And so, because we had done the work, we were able to have a more balanced approach. We brought in additional revenue. We did reduce state spending by about $500 million, but we did it in strategic areas that were not education, not health and human services. We set our priorities, and there's still more work to go. But this issue of the federal deficit and the shifting of those services to state and local governments is the challenge of our time. And when we care about education, when we care about health care for all people, when we care about making sure that young people have a good start, a strong start, then you have to care about how the budget gets decided by your local city council and county commission, by your state legislatures, and definitely by our Congress.